Newham Central One primary care network, and we are made up of 7 practices. The smallest list size is 5,000, the largest list size is 13,000. We serve 65,000 patients, so it is a large network, and that's just over an eighth of the population of Newham. The reasons for our primary care network coming together today was to undertake some quality improvement. This year in our QOF, we've got 2 quality improvement indicators, each worth 37 points each. One is on end of life, and today we're concentrating on our safe prescribing. Back in December 2016, I took part in the General Practice Improvement Leads programme, which is part of Time for Care. And I wanted to use the quality improvement skills that I have learnt and the tools I've learnt to help us achieve that, but also help us work together and build our relationships up. It's looking something like this, if it all goes to plan. 1 to 2, we're doing a beautiful process map on quality improvement.
We've actually developed a Newham, particularly in Central One, where pharmacists can start actually engaging with GP practices and primary care networks to understand what we can offer them and what GPs are actually doing at the moment. So for me to actually come into one of these meetings to understand what the actual processes are, what the actual mapping looks like for now, in the future, and the next 5 years, it's really important for me to understand where I can fit in and what we can do as roles within community pharmacists to support the practices and primary care networks.
It's really helpful in terms of getting into the detail and working with our peers. And because we have both practice managers and GPs in the room, then we can look at both the admin processes and the clinical processes and have a joined up approach. So that's what's really useful about doing the process mapping in a group like that. And then you also get ideas from other people about what they're doing, even if they're calling it something different.
Doing process mapping at a network level, I think, has phenomenal benefits. It can reduce variation, which we know is an issue for our CCG, for example. It can also give the patients across our network one service, one voice. It's very confusing being a patient that if you go to one practice, they're doing something a bit different down the road to another one. It also helps sharing and learning from different practices. We all have things that we're good at and things that we could improve on, and collective brains of 7 practices is always better.
You get to think about the wider issues and think about the population and population health.
I was worried that our practice must be doing something wrong, that we're not achieving the targets, and the same 6 patients are going to A&E. But I've just realised it's not just me, there's other practices that are having the same problem. And there was one thing I recognised, till one of the other practice managers didn't say it, I didn't pick up on it, mental health, dressing. So we're not the only ones having that problem, everyone's having that problem. So as a network now, we can help solve that problem because we'll take it back to the CCG.
Taking it back into the practice always includes a little bit of a challenge, because if you get back to your desk and real life seems to take over. But the more we do it, is the more we can integrate it and build it into what we're doing back in the practice.
Having been involved in this has actually improved the way we can work in terms of integrated care and actually improve the patient journey.
I'm really pleased to hear that there is local and national support available for PCNs, and we're very fortunate locally that we've got the Time for Care programme coming in, and also there's not just the GP Improvement Leads programme, but there's the Leads programme for nurses as well as for trainees. So I'd waited about 15 years before I learnt about quality improvement, but I'm really pleased to say that now ST3s can actually go on this sort of course to learn about quality improvement, just to help them in their working day. If we really want to achieve our aims of primary care networks being the building blocks of integrated care systems, then quality improvement is a vital tool for us to use.